The much heralded debates on healthcare didn't materialise in March Tynwald, but there was still lots to talk about. We'll hear later from the Chief Minister and Health Minister, newly elected MLC Gary Clewett and Laurie Hooper MHK. First though, Speaker Ewan Watterson explains why he wasn't keen to debate the health overspend at the March sitting.
Well, I think if this is a supplementary vote rather than a supplementary budget, we should know what the overspend is and vote on that supplementary budget. I think giving them the last sort of 2 weeks of the year with an extra contingency in that wasn't the right move, wasn't the right way forward. There was in that 20 million, 3.1 million, I think the quote was, general risk of performance on the financial forecast or something like that, which was a slush fund for any other overspends in the last 2 weeks, whereas I do want the Treasury, DHSC and Manx Care to keep the focus on right the way out to the year end and of course beyond that, to make sure that they're getting good value for money at all times.
And there was a bit of confusion about the explanatory memorandum, which should accompany motions such as this and explain in some detail what was actually involved. What went wrong with that?
Well, it would appear that the Treasury had submitted a explanatory memorandum but hadn't made its way onto the order paper. So a lot of people hadn't seen it. It was there sitting in the background on the register because people rely on the order paper for what they're going to debate in the sitting. So a lot of people hadn't seen that.
And of course it amounts to, I think it was 2 or 3 pages for £20 million.
Yes, it wasn't necessarily an adequate explanation, which I would hope that we would get something a bit more detailed ultimately with the supplementary vote, because one of the reasons, one of the things that Tynwald tends to look for when a supplementary vote comes forward is, how has that happened? What have we learned? What are we going to do differently as a result? That wasn't a focus of this debate, and this was more of a procedural motion, but I would expect that that's where that debate should go when we get to the actual overspend of Manx Care at the year end.
And of course, had the vote gone through, we potentially would never have really known what the true amount of the overspend was.
Well, that's the danger. I mean, Public Accounts Committee is doing an all evidence hearing at the end of this month on the accounts from last year and the budget of this year. But of course, they're both after the fact. The budget's already been passed, the accounts have already been laid. That sort of after the fact scrutiny is slightly less worthwhile in the basis that it's not as likely to develop policy in real time. It's a slower attempt to try and consider things afterwards, but it doesn't quite have the traction that that sort of live debate would have in Tynwald.
So what happens next? Presumably the Department of Health and Social Care and indeed Manx Care have a gaping hole in their finances. When does that get filled? Well,
the gaping hole in their finances, of course, has existed since April. It seems to be the collective wisdom, so there's nothing new there. What will happen now is that, I hope that there will be continued financial scrutiny right the way up to the year end on what the money is being spent on and making sure that it's providing the best value for taxpayers and patients on the Isle of Man. We'll then find out what at the year end their overspend actually was, and we'll vote on that, but we'll vote on that with a view to seeing where it's gone, why it's gone that way, and what sort of lessons will be learned going into the next financial year and what we're doing differently.
That was Russian MHK Ewan Watterson. Next, Chief Minister Alf Cannon on the updates to our island plan.
Well, I think you'll find, if you study the document, that it has actually been refined in line actually with a lot of the feedback that's been received from Tynwald, from the public meetings that we've had as the Council of Ministers, and from influences that have been brought about, say, from the Tynwald Scrutiny Committee. So the document itself has refined. We've really focused on the priorities, I think, that have been brought to the fore in terms of our key headlines, although the national indicators that we started out with in terms of growing the economy of the island, putting more people into work, building more houses, are very much still there. So I think it's a refined document. This current version really outlines what we seek to achieve and deliver over the next 12 to 18 months, but also continues, I think, to bring and highlight those critical areas that we need to be, such as financial discipline in terms of the public spending programmes, our energy security on the island, building more houses, and of course continuing to develop our economy.
Several members suggested that the plan indeed has changed, but it seems to have lowered its expectations, and indeed the issues that matter most to the members of the public don't appear to be being addressed by the plan. I think Laurie Hooper specifically targeted the whole housing situation, and an original ambition of 1,000 homes, new homes occupied by the end of the administration, is now being reported on as we've got all these planning permissions. I suppose you've still got a year to get the planning permissions built and people in those homes, but he does sort of have a point there.
Yeah, measuring that has to be done through a number of sources, and there is ways that you can get evidence of that, including the numbers of houses sold, for instance, as a measure. The planning, the number of houses both that have received planning permission, the number of houses that we expect to receive planning permission. But ultimately, of course, the real test in all that will be the next census as the most accurate deliverer of whether we have achieved that aim. But there are measures that can contribute to the overall indicator that we have put more people into homes and that we have built the homes that have been needed to try and alleviate some of the housing crisis. And I think it has always been a difficult challenge, housing just being one element. You said an ambitious plan to recover from coronavirus and the impacts that it's had to try and drive the economy through periods where we've had significant inflation, Ukraine wars, and all sorts of other global turmoil, to try and actually sort of satisfy every single need that occurs as a result of that ambition to grow the economy by creating more jobs, by putting more people into work. But those measures are there, the indicators are there that will support progress. And yes, of course, ultimately then there will be a final arbiter, but that's going to be towards either the end of this administration or ultimately some months or even a year after before you can sort of see the final results on how successful some of those indicators and measures have actually been.
Mr. Thomas suggested that there were similarities to old Soviet-style plans where the Soviets would report on what they have been effective at, which Mr. Thomas used the example of building tractors. Actually, there may not have been any need for the tractors, but we've built the tractors anyway, so we're going to report on them. Is there a bit of that in this plan?
No, I don't think so. I think it has been a very genuine document that we have, as I say, presented every year to Tynwald to take that feedback. It has provided a basis and a structure for government across the departments to focus on the important issues of the day. And look, I'm sure there have been areas, of course there have been, where one would have liked to have done more. I don't think the social housing programme, for example, would be anything like as much progress as we had set out in order to achieve. So one has got to accept there's going to be weaknesses. But at the same time, in amongst that, we also need to be sure that we are driving the big picture forward. And that does mean setting out the high-level objectives, using the national indicators, taking comfort that many of those indicators that we set out to achieve are pointing in the right direction, and that our economy, albeit slowly, still maintaining a period of growth. So there's a lot still to be positive and confident about, that the overall strategic plan that was set out is being delivered. But of course, as members quite rightly said, and I said at the beginning of the debate, of course we're open to scrutiny and criticism. There are areas sometimes that we have not have delivered on as effectively as we could, and one must never forget, of course, that we have to continue striving, because it's not always easy for people not on the island, to carry on growing as families and as individuals, when they continue to experience really quite difficult balances, between income and the costs of living. So there's still a lot that we can do. I'm hoping that as we push through this year, the tax cut takes effect, that we will see improved economic conditions, and that there will be some light seen at the end of the tunnel for people once that takes effect at the beginning of April.
I guess 3.5 years ago you would have hoped for more significant progress when Council of Ministers first met and was discussing the economic strategy. You would have hoped to have seen more activity by now. When you look at the way in which Donald Trump has began his presidency, and also actually you see how even the UK government is now talking about the need for a fairly radical reform and change in the way in which government is delivered. Do you have any regrets that maybe you weren't a bit bolder in terms of trying to push some of this through?
Well, first of all, it's not over, Phil. We've still got 18 months to push through, and there's stuff in the pipeline that we'll bring forward to the public once we've sorted it out internally. You've got to remember, of course, that Keir Starmer runs a huge majority and a political party, and has significant endorsement because of the party structure. I'm sure it's not all going to be plain sailing when some of these reforms are coming through, particularly welfare and healthcare. And of course, Donald Trump has lots of capability to make executive orders and the political structure. But even he can bring the headline, and it doesn't always go through because it is blocked through either court systems or through their own political processes. So I think you have to put the balance of the type of democracy that we run here. I would love to make more unilateral decisions in a number of areas, but I have to respect, of course, that I very much chair a collective Council of Ministers. We share that collective responsibility. We make decisions together, and sometimes the process around that can be slower than perhaps others parliamentary structures can deliver, particularly in their sets of circumstances. But that's not to say, of course, that we don't eventually make the right decision. And I think you will agree that perhaps it's always been a criticism of Tynwald, of government, that it takes a long time sometimes to get to the end destination, but we do get there in the end. And having said that, a lot of people on the island will feedback that they like the non-party structure, even though, of course, it does mean that it changes the balance of power quite a lot, and does require a lot of collective decision making with quite a diverse group of people.
One thing that perhaps Tynwald, maybe you weren't expecting, but certainly 11 members of the House of Keys decided not to support the suspension of standing orders, and some at least of their support was required so that you could effectively plug the gap in the Manx Care DHSC expenditure. Do you think maybe you were wrong to try and bring that forward in March, and would it have been better to have waited actually to April when you had a better handle, better understanding of what the scale of the problem actually is?
Well, historically, we've always voted through the supplementary votes before the end of the year so that the money has been properly allocated to the department so that they can carry on spending, or effectively know that they have got that authority to complete their year within the new allocated budget for them. So the debate's going to take place in April. People have been asking for more clearer figures from Manx Care. Whether we get those figures in April now, whether it's May, because obviously there is a period of computation to take place and auditing around those final figures, if that's the kind of figures that are wanted. But I did notice last year, of course, when there was a £30 million expenditure, the former minister was on his feet saying, well, I've put in £30, it could be a bit less, but I've had to make some allowances. I don't have the final accurate figure. So actually, we seem to have, as one of the proponents for voting against, we seem to have sort of flipped into sort of double standards again. Look, we're working hard to, as I've told you many, many times, to get healthcare spending under control. It's hugely important that we do that. And I'm, clearly sorry about there's been some disruption, but not to go through this process would be much worse for people in the long term unless we start to get some discipline into the spending that's going on and the way that's been spent and the way that things are being monitored within health. And the debate's going to need to be continued. So in some ways I was a bit surprised actually that people didn't want to debate healthcare spending yesterday, because I don't think whether the figure's now 16 million or 17 million is that important in the terms of the context of discussing the government's overall approach when it comes now to sorting out Manx Care's finances. So, but yeah, I mean, I think, fine, I'm a bit surprised, but there we go.
Keir Starmer seems to think that the system that we've ended up adopting needs to be reformed, and basically the powers going back to the health department, and this whole kind of Manx Care DHSC model that we've got, which was based on a UK model, seems to be now that the UK is reversing.
Yeah, I mean, there's still quite a lot to sort of stand around that, but I understand the general. If we just talk about the general direction of travel, it is going to be something that we are going to have to examine. There is clearly, just to go back a step, when I sort of did my stint as health minister, one of the 5 things that I highlighted to the chairman of Manx Utilities, the health service of Manx Care, for Manx Care, was that one of the 5 issues was governance, and we needed to work out how the relationship between the DHSC and Manx Care was operating. That still needs to be done. Chris Thomas obviously brought a motion about this and asked, I think, the DHSC to come back in May with some proposals around that. I think there's going to be perhaps a broader examination needed now. It will take some time, but we are going to have to look at this governance issue moving forward, and I'm sure we'll be sort of determining how and if and when such a look at that governance is going to take place and under what structure.
Chief Minister Alf Cannon there. Laurie Hooper was one of several members who were disappointed by the Our Island Plan updates.
Yeah, I mean, I'm still a firm believer in the direction that plan originally set out. I think sorting out your tax base, sorting out your economic strategy, and actually dealing with some of the social issues, especially around housing, absolutely critical. My worry is we're nearly 4 years in at this point, and how many houses have the government built? And the answer is none. And I think that's the issue I had with this document, they set these aims out, but then what they're measuring are not the things they're achieving. So to try and turn around and say we're going to occupy 1,000 more homes, and the way we demonstrate that is by saying lots of houses have got planning permission. Well, that's not the same thing at all. Actually, there's loads of houses that sit in planning forever. They get planning permission and then they just don't get built, or they don't get built in a reasonable time frame. So it's a bit weak, if you ask me, that plan. And that was the point I was kind of making, was your direction of travel is probably still the right one, but you're not demonstrating success. You're not showing us that you're capable of delivering. And that wasn't really helped by the fact that all the ministers seemed to stand up and talk extensively about all the great things their departments had done, but none of that was in the Island Plan. They were all the things they were doing individually. The Island Plan itself actually doesn't seem to have moved forward in any meaningful way, and that was the issue I had with it, really. And of course, the other thing, as I said in the debate, is the government makes lots of promises, but at the minute they seem quite happy to U-turn on just about everything, whether it's good, bad or indifferent. They don't seem able to pick a course and stick to it. So really, what value is there in an Island Plan document when there's a pretty good chance everything in there, as soon as it becomes contentious, the government will back away from?
You were part of the Council of Ministers that devised the initial plan. I've already asked this question of the Chief Minister. And are you, well, if you can remember back, I'm sure you can, 3.5 years when the plan was being initially devised, would you be disappointed in where we're at if you could, if you move that 3.5 years on? Had you expected more to have been delivered?
I think the answer to that is yes. I mean, like I said, I still support the general direction of the plan, and I still think the original aims that we had to get more people in work, more people in homes, these are the right things to do. Like I say, the problem is what you're starting to see is it's not delivering. There's only 474 more people on the island compared to when we started. That's according to the government's own numbers. And what we're seeing in work is there are lots more people in work, but it may be that it's lots more people working 2 jobs or 3 jobs, and really that isn't a good sign. Really, you want people to have a steady job that pays the bills, not having to work multiple jobs just to keep a roof over their heads. And so the problem I have with the plan is exactly as you said. It's not where I was hoping we would be after 3.5 years. I thought we'd be further along. I thought there'd be more housing in development, that we'd actually have delivered on some of these things. And it is tricky because ultimately, when you're in the Council of Ministers, you have your own portfolio. So I could say I'm quite comfortable with the direction that health was going in and the things we were doing. But the things that you have less control over, sometimes it is quite disappointing to say I thought we'd be further down this road than we are.
And I guess the increase in people in work is also, it actually goes back to the time when we had COVID and an awful lot of people weren't in work as a result of COVID. The figures, if you compare to where we were prior to COVID hitting and the dramatic fall in jobs, it's not really that big an increase, is it?
And I think that's something else that I was trying to point out. So in relation to the education figures, their aim is to improve educational outcomes, but when you actually look at the data, that isn't happening. And actually, on the one hand, should we just have accepted, actually, we've got reasonably good outcomes here. Our aim should be to keep them high rather than trying to make things better. But what we've actually seen since COVID is a decline in some areas. And that doesn't seem to be talked about. And that's a real problem I find with this government is rather than acknowledging the challenges they're facing and talking about them, they kind of hide them. So when I made those comments in the debate, no one from the Education Department stood up to talk about actually where we're at and things that are happening. Even the Minister wasn't there in her defence, but her members could have stood up and explained it. The Chief Minister could have stood up and dealt with it. But they don't want to talk about what isn't happening. They only want to talk about the things that are good, whereas actually the only way you deal with the things that aren't quite so good is by being open about them, talking about them, and being willing to tackle them and to have those difficult conversations. It didn't feel like ministers were willing to have those difficult conversations in that debate. It felt like a ministerial love-in, I think it was described by one of my colleagues. And I think that's kind of how it felt, was lots of really good, glossy news coming out of the Council of Ministers, but underneath that gloss, maybe it isn't all working quite as well as we'd like it to.
You're becoming a seasoned politician now. You've got an awful lot more experience about how the system works, or perhaps how the system doesn't work. Some of the delays, the reasons why the initial aspiration hasn't been delivered are external forces that can't be really that significantly influenced by government. But there will be some of this is down to the whole way in which government works. Does there need to be some form of reform, some sort of change?
Yeah, I'd agree with that, and I try not to blame government for things that aren't their fault. I blame government for a lot of things, but if it genuinely you think actually that is an external issue, it's not a lot we can influence, you kind of have to take that on the chin. What you have to then look at is how government responds to those changing external influences. And I think you're right, the core issue we have on the island is that our political structure, our political system is quite disjointed. We talk a lot about things like consensus politics. What it really means is you've got 9 or 10 ministers at the moment, as it is, all pulling in 10 different directions. You don't have a shared vision, a common aspiration, a common goal. They're all very different people with their own views on things. And I think that came through a bit in the debate where the ministers were talking about how good their departments were, but it was the Chief Minister's island plan. And that is an immediate disconnect. It's not their collective island plan, it was the Chief Minister's island plan. And that was quite an interesting nuance to listen to in that debate. And I think that's the issue. What we really need on the island is a group of people that have a shared political outlook, shared policy aims, all wanting to move in a particular direction. That's the only way you get meaningful change. Otherwise, we'll always end up having fights and disagreements over every single issue, and not just we may all agree, for example, the minimum wage should be higher, but actually I don't think the council ministers all necessarily agree that. And so you're even fighting on the core principles sometimes in that room. It's not like you can go in with an agreed position and you're fighting over the details. Sometimes you're actually fighting over the position. And that is a real weakness of our political system. And I would say this, but it is all down to a lack of that kind of political party structure or anything similar on the Isle of Man.
And of course, the Chief Minister, when I asked him these questions, particularly in terms of the initial aspiration and is he disappointed with the delivery, he pointed to the fact that he is the chairman, in effect, of a committee of members, basically the Council of Ministers, and he can't rule by diktat in the way that perhaps we're seeing particularly in America at the moment, and also with the Labour government, which has a thumping majority. So it may be that the Chief Minister has bolder ambition, but he has to bring his now 9 colleagues in Comen along with him.
Yeah, and that's fair. It is a coalition government, if you think of it in those terms. The Chief Minister we like to think of as being the Chief Minister. He has a lot more soft power, I think, than maybe he utilises, but I suppose every Chief Minister is different in that respect. But yeah, the Chief Minister's not wrong. He is essentially the leader of a coalition, and it is not a case that he can demand something and it happens. I mean, and when he does, often the consequences are laid bare for all to see. So the challenge I think he has is maybe he does want to be more bold in some areas, and this was very true in the kind of health space. He and I have very fundamentally different views on the direction of travel for the health service. I'm a firm believer in universal healthcare. You can see that at the moment the government is not, and that's a fundamental disagreement. The problem is, of course, the Chief Minister can't tell people do this. He needs to have the support of the relevant minister and then enough members around that table. And it's an interesting one for me because ministers often will say, well, that's not my policy, that I've got to support it by collective responsibility. And you sit there and think, yes, but a majority of you must have supported this because the Chief Minister is only one vote around that table. I appreciate he can hire and fire, but he has run out of options in terms of hiring and firing. I think everybody now, apart from perhaps Stu Peters, Tim Glover and Jason Morehouse, has been a minister in this administration. So it is quite difficult, I think, for them to hang on to that thread of, well, it wasn't really my fault, it wasn't really my job, I'm not the one involved, when you can look around the table and go, well, you must be. And if enough of you felt this way, this wouldn't have come out in the way it's come out. And so it's a difficult one. And again, it all comes down to our system being quite disjointed. They haven't gone in as a party, with a collective view. You've got 10 people with 10 different views, and every time a minister changes, they'll bring their own views to the table, which could be very different to the views of the previous minister that sat in that seat. So it isn't. There is no simple solution, and I know people would really like there to be, we can just reform this and the world will be better. But ultimately, it's a complex problem, and I think the only real way of solving it is to have more coalitions, more parties elected at election time, and whether they are formal political parties, whether they are loose political groupings, ultimately that's for the electorate to decide, but that's the only way you're going to see real change over here.
That was Ramsey MHK Laurie Hooper. Gary Clewett MLC made his maiden speech in the debate on the reform of Legislative Council.
Possibly the worst possible topic for a maiden speech ever. It was just, it felt uncomfortable to some extent because you're brand new there. And here you are sort of trying to justify your existence type thing. It is what it is, and it's out of the way. It was kind of nerve-wracking. I mean, I've done lots of public speaking, but never in that sort of forum. So it's out of the way, and now we're just up to taking bets on when Mr. Reid gets his opportunity.
Yes, because of course Kirsty Morford asked the question earlier in the.
So she's in.
Yeah, we heard in Agenda last week about what the mover's intention was of bringing forward these reforms. It's fair to say she didn't get an awful lot by way of support, except for declaration of interest in advance of an election.
Well, I mean, that's just sheer common sense, and I'm quite surprised that it wasn't an absolute mandate for any elected position. Quite frankly, it should be and should always have been. But I think the motion wasn't very well constructed, I think, is the issue. There's certainly no question that there is room for improvement, room for reform, but it is a longer term, I think, question. Not that it's important, not important, it's that there are a lot of implications on whatever we do, and they have to be carefully thought out, because the last thing we want to do is make the situation worse than some people view it as today.
And some people describe any consideration of constitutional reform as navel-gazing, and actually we've got far more important things to be getting on with. Is that a fair challenge?
There's some merit, but not entirely, because, I mean, frankly, in life we have to walk and chew gum, as they say in America. I mean, yes, there's some very important things that we have to get on with on a day-to-day basis, but you can't keep putting things off and saying they're not important, they're not important. They are important, and I think there needs to be consideration for doing these things in parallel in the background. It doesn't mean you say you stop doing the important things, but it is important, but at a different level. It's not urgent, as it were. Although, again, I can certainly see some members of the public thinking, yes, it is. It's not only urgent; it's well overdue. But that's the system we have to deal with. It didn't go down too well. But I think that was more to do with the structure of the motion, and that there are other ways that it can be addressed. And as I say, it's I give her due. It was a good introduction to people need to think about it. I think we continually need to think about reform, actually.
One of the things you mentioned when we last spoke was that when you received, or if you were successful in being an election, you would take your salary, but you would most likely distribute that to researchers and assistants. There seems to be a suggestion, certainly I've seen in the media, that maybe you've changed your position on that. Is that the case?
Not at all. That was my thing. I'm hoping to create one, possibly even two new jobs on the island for things that, again, outside of the pure parliamentary type things. There's a lot of research, help with speech writing, various other things that need to be done. When I said I would happily volunteer, I've been volunteering for the Housing Communities Board for the last 2.5 odd years, and if it were a voluntary position, then I would still have applied. I mean, because there is criticism out in the public that, well, these people are doing it for the money. Well, I'm not doing it for the money, but you can't win. And it's not fair to say that, well, we want to populate this with volunteers, because that implies certain peoples of independent means, and that's grossly unfair to people who can't afford to do that. So, what my alternative was, I will try and use the money to create some jobs and some help for me, and potentially groom some people into politics who may at some point stand for themselves.
Newly elected MLC, Gary Clewett. Next, Health Minister Claire Christian, who had a quieter Tynwald than expected.
Yes, so the first item, the supplementary vote. So normally how that's happened in the past, the supplementary vote last year was exactly the same. The Treasury Minister brought it through for the three departments that had an overspend. It was brought through exactly the same way as it was for this time round. And there were some specific reasons which were raised by honourable members, specifically the Speaker, regarding about keeping the, I can't remember his exact phrase, but I think it was the foot to the ground on Manx care over the next 13 days, so that we would get a more accurate figure for the exact supplementary vote. So of course what that means is we will wait till the 7th of April now for those financial figures to come in. I mean, it probably won't be till May, Tynwald, that will bring back that paper, because we're listening and people want those accurate figures.
And of course the reason it would have to then be May is because of the issue that you've come across in this week's Tynwald, in that you couldn't put the motion down 4 weeks in advance.
It's the timeline.
Yeah,
exactly. It's the timeline. So obviously it would have to go through the Council of Ministers, obviously be laid, and it has to be on the 4 weeks of register. Yes. So
in that regard, then I suppose the first thing in that 20 million overspend. What happens? Because I guess you've only got authority to spend the money that Tynwald agreed to at the 2024 budget. If you are overspent by at least 16.5 million, then there's clearly going to be a gap in the funds.
Yes, Phil. I mean, obviously that's a matter for Treasury to confirm and to answer. But I believe that the funds will be made available to obviously to when the supplementary vote happens.
So then we get to the debate that didn't happen on the Manx Care mandate and operational plan. I guess that you had some clarity about how this was all supposed to happen, and the only reason that a suspension of standing orders was required was due to a relatively minor administrative slip on the department's part.
Yeah, the department have been working at extreme pace, and I'm not going to blame them for something, half an hour missing the deadline. The mandate and the operating plan were laid in time, so they were laid before, so we met our statutory obligation. It was the actual motion for the debate, so they're two different things. So I understand that honourable members, they obviously have seen Mr. Hooper's motion for next month, but to make it very, very clear that the law states that the mandate only and the operation have to be laid. It will become effective on the 1st of April regardless of any future debate. But we are listening. That was the point of today. That was absolutely my intention, was to hear the voices of the people that had reached out to their MHK. So that debate, I feel it's a shame that didn't happen today, because I have not heard that, and now I have to wait another month for that information.
So will you be moving your general debate as well as having the debate that Laurie Hooper has down, which will cover similar topics, but effectively it'll be in the hands of Mr. Hooper to sum up and describe how the debate went?
No, because we would have to have it laid before 4 weeks of business, and obviously we would just be in the same situation again. But the motion can be amended. That would be something that we would be looking at, perhaps. So,
let's go back to maybe the beginning of March or February time. What was your initial intention? What had you proposed, and had the half-hour deadline not been missed? What would we have been listening to?
Yeah, so the key areas that I really wanted to talk about was bringing care closer to the home, where we have additional primary care, dentistry and community service appointments, making better access without needing hospital visits. More support and intervention would be made available within the 4 locality hubs, which essentially are sort of like one-stop shops for increasingly wide variety of support, such as specialist mental health support, social care, and support for those recovering from illnesses or injury. We obviously wanted to talk more about as well as the smarter hospital use, so only using clinically necessary hospital appointments will continue, ensuring a timely care for those who need it the most. And also reducing the use of follow-up appointments, so only using those to care and support those with significant clinical need. And I think that, I've spoke about this before in previous interviews, where what that really means is, so for example, if you were bringing care closer to home, doesn't just mean within a GP sense. It also means if you're going to a tertiary provider, across into the UK for your care, some of those appointments can be brought closer to home through either follow-up appointments that way. And I have literally over the last couple of weeks, couple of months, I have been receiving some really positive feedback, which I would have loved to have talked about today, from patients who have said, fantastic, I can do my appointment here on the Isle of Man, this is really great, this is really positive, and they are grateful for that. But obviously, if there is a clinical need, and absolutely those appointments would absolutely still continue in the UK. I want to make that really, really clear today. There are obviously talking about financial sustainability as well. That's really, really important. Tighter management of travel for specialist care, promoting virtual consultants where feasible, improved partnerships with specialist services, financial discipline, requests for specialist centre funding will be assessed against allocated budgets. So there was an awful lot that I would have loved to have covered today, and with some really good positive stories, but also to just lay the ground of what we're facing. You know, this is we're not unique here on the Isle of Man about the expensive drug charges or increased inflation, etc. We're not immune to that. So we have to build a sustainable healthcare system for the future. This isn't just about now. This is absolutely about the future.
I mean, there's so many things that we could talk about, but perhaps one of them is the maybe you could call them misunderstandings, but the way in which the mandate is worded. There are the various columns. One of the columns is for changes, and a number of service users have been concerned to note that there appears to be a change, and when you've been approached, you've said, "Oh no, it's not. That's not what it means." But certainly, a number of your colleagues have said, "Well, actually, this is what it says, whether that's what it means or not." Could a clearer, less debatable version of the mandate have been produced, and maybe is that something you're going to be looking for next year?
Yeah, I think as I said, this mandate was produced, I think, within 6 weeks, and it was a phenomenal at pace document. I want to start that absolutely far earlier. Obviously give the department a little bit of breathing space, but I'd be looking at starting that process in June, consulting with people, consulting with stakeholders, working with MHKs, really talking to people about what the situation is and where we want to go, looking at core services, maintaining that, and what are our priorities for the following year. And I think, and obviously we talk a little bit also about the stakeholders. Obviously that includes, for me, the Isle of Man Medical Society as well. It includes the colleagues that we work with obviously at the hospital, and GPs, etc. So it's really important for me that I feel like I can get my feet on this now and run with what we need to do. That I am open to how these things change and can change. There's definitely and I am listening to the public, there's a definite disconnect from what people understand is necessarily Manx care. And when I say that, I think about all the great work that Manx care does, and I'm talking about the people that people see every day, whether it's women's sexual health, whether it's mental health services, whether it's the doctors in the hospital. Those people fundamentally are absolutely working exceptionally hard to provide a really good service, and we don't celebrate that enough, and we don't talk about that enough. So that's something that I really want to sort of uplift and really bring that to the forefront, to show that what we have done and do. And as I said, I'm open to change. I'm open to the way that the structure and the governance needs to be reviewed, and we are bringing back a motion in May on that. And I think there could be some really positive changes, and really listening to what the public want. I know the Chief Minister's just done an interview as well, and he's highlighting that actually, I just heard him saying that we are looking at how, and I agree with him, we are looking at how this governance can be improved, because when people say bad things about Manx care, I think they're sort of probably not really thinking about those people in the hospital. And I understand that. That's why I want to just differentiate that. I want to make sure that we absolutely don't mean those people, or anybody that's saying about Manx care and the problems that they're having is not about those hard-working people.
Mr. Hooper, his primary motivation for opposing the debate happening today, the suspension of standing orders, was because he believes, and he certainly asserted this in Tynwald and in various media outlets, that this is a radical change, the Manx care mandate and operating plan, radical change, which is why he wants Tynwald to be able to have a vote as to whether or not they're prepared to accept this. So, I mean, you're saying you're willing to accept change, but I guess you're not. It's going to be difficult to accept change on the floor of Tynwald in terms of a revised mandate.
Yeah, I'd like to understand. I would have loved to have understood that today in a debate. Now we could have started working on with him on that. He still hasn't come to me to talk about those radical changes that he thinks are happening. As far as the looking at the bringing care closer to home and reviewing waiting lists, that was part of R&R3, which was something that he was part of and was an architect of. I'm a little bit of a loss as to where and what, and until he engages with us, then my door is open. I'm absolutely a loss as much as you are probably, Phil.
So do you reject the suggestion that there has been a radical change in the mandate and the operating plan?
I think that there are changes, and absolutely, in the sense, as I said, it's bringing care closer to home, and I think that is something that's really, really important. And that's something we've listened to. That's something that we've made those changes. As I said, until I know what his version of radical is, he's obviously entitled to that view. I wait to hear it.
So you've mentioned consultations and discussions with all the stakeholders. One of the questions that you had to answer, of course, was in relation to nurses' pay. What is the situation as you understand it with regards to that?
I gave a full update yesterday, which has come from Manx Care. Manx Care are obviously leading on the negotiations. I obviously can't talk about those negotiations because they're in currently, as you know, Phil, they're currently in. Whilst that's happening, you can't really discuss that. But as I said yesterday, I'm aware that obviously the nurses balloted in favour. I think it was 68%, I think it was, but we don't know how many of their nurses that made that 68% made up of. So that's all the information I have. There was a meeting, the 19th today, is it? Yes. There's a meeting obviously today, and obviously we'll wait to hear the outcome of that.
But effectively for this financial year, the department has effectively said there's a 4% increase, and that's all the only assumption you have for this year is that 4% is all that's going to get paid.
So they have allocated 4% within their budget. Yes, Manx Care have done that. There are other ways that they obviously can look at terms and agreements and things like that and in negotiations, but obviously that's something that they need to work through.
Another thing that's been mentioned to me is the situation with the MRI scanner. What is happening with that? I mean, is it operating well, or is there an issue with that?
So I believe obviously the MRI scanner, as far as I'm aware, yes, it is operating, but there has been a funding paper that has gone through, and I believe that's gone through Treasury now to be approved to have a replacement. And
is that likely to be in the next financial year?
I'd have to confirm that, Phil. Sorry, I don't have the actual. I know it's just gone through, so obviously it'll be happening very, very soon.
That was Health Minister Claire Christian, MHK. Finally, Middle MHK Stu Peters, who questioned the Infrastructure Minister on plans to introduce 20 miles an hour speed limits in residential areas.
In principle, I don't mind the idea of 20 miles speed limits in residential areas. I am slightly concerned about the rationale behind it. I'd assumed that it was to improve road safety and stop pedestrian accidents. Apparently, according to the Minister, that's not what it is at all. It's about improving the quality of life of people who live in residential areas. Well, most of them, you can't do more than 20 miles. You can't even do 20 miles an hour in most residential areas. So I think it's a bit of a sledgehammer to crack a nut, to be honest. It's a case of government telling people what they've got to do rather than encouraging them to do things. And I think it's pretty unnecessary. One of the questions that I asked the Minister was whether or not pedestrians were going to be asked to take more responsibility for themselves, because whenever these things come out, it's always the motorist that gets it in the neck. Whenever there's a pedestrian versus motorist incident, I'm sure the motorist is the one who's got most to lose. But more than that, it comes down to the fact that everything that government seems to do, or everything that DOI seems to do these days, is all predicated on making driving less attractive.
You asked the Minister, did she have a plan? Or you suggested perhaps the Minister had a plan to discourage people from using their cars. Were you surprised when the Minister said, actually, we don't have a plan, and the whole issue of this 20 mile an hour speed limit thing has been very poorly communicated?
Well, I think that departments have plans without actually crystallising them and putting them down on paper. And I think it's more a political ideology. You know, let's hit the motorist, let's make it less attractive to drive a car. Let's try and promote the idea of these 15-minute cities and, you know, cycle to work and all the rest of it. And that's an ideology. I mean, for somebody my age, cycling or walking to work isn't ever going to happen. I need a car. And an awful lot of people are in the same boat.
That was Stu Peters, MHK. So what do you think? Should Tynwald have debated those weighty health topics? Are the updates to our island plan bold and helpful, or watering down aspiration? Let me know your thoughts on the programme by contacting Phil Gaughan at manxradio.com, and get in touch if you have any ideas for future shows. Don't forget, this programme is available as a podcast on Manx Radio's website. I'm Phil Gaughan. Go to Myos and Geistachrom. Thanks for listening.